This video has been developed by the Women's and Men's Health Physiotherapy team at Oxford University Hospitals. It is designed to provide some initial information and advice for the management of pelvic floor disorders, including urinary incontinence and pelvic organ prolapse. This video is not designed to be a standalone treatment, but to provide part of your physiotherapy management. If you have been referred to our team, you will be followed up by a physiotherapist to discuss your symptoms and management further. Our contact details are provided at the end of this video, should you have any questions regarding this information. Hi, my name's Jo, and I'm part of the Women's and Men's Health Physiotherapy team at Oxford University Hospitals. In this video, we're going to talk about some advice regarding the physiotherapy management for urinary incontinence and pelvic organ prolapse. So we're going to talk a bit about these conditions, go through some general bladder and bowel management advice, and I'm going to talk a little bit about pelvic floor exercises, but you'll also receive a link to another video specifically dealing with pelvic floor exercises. You may find that not all of the information in this video relates to you, but what we hope is that you can take some of the advice from this video and start to put it into practice. Let's first discuss the conditions mentioned, starting with prolapse. Pelvic organ prolapse is a term for the descent or bulging of one or more of the pelvic organs, so the bladder, uterus or bowel, into the vagina. Sometimes prolapse is described according to which wall of the vagina is affected. For example, a prolapse of the front vaginal wall is commonly caused by descent of the bladder, whilst the bowel or rectum may cause prolapse of the back wall of the vagina. Prolapse tends to be due to a combination of reduced pelvic floor strength, supporting from underneath, as well as reduced tension from the connective tissue which lifts and supports the organs. Symptoms of prolapse can include a feeling of dragging or heaviness in the vagina, seeing a bulge down below, backache, and discomfort during intercourse. Symptoms may be made worse by activities including heavy lifting and standing for a long time. They may also commonly be worse towards the end of the day. Prolapse symptoms and the degree of descent can differ widely. Some women may have a large prolapse with little or no symptoms. Other women can have a small prolapse but be very symptomatic. So, the degree of descent does not necessarily determine how severe your symptoms are. Our aim with physiotherapy management is therefore to work on improving your symptoms and how bothersome they are. As mentioned, we are also frequently referred women who are experiencing urinary incontinence. Urinary incontinence refers to the unintentional passing of urine. It is very common, affecting approximately 1 in 3 women. There are 2 main types of urinary incontinence: stress urinary incontinence and urge urinary incontinence. You can also have a combination of both stress and urge incontinence, which is termed mixed incontinence. If we first consider stress incontinence refers to leaking of urine with activities such as coughing, laughing, sneezing, bending, lifting, sexual intercourse, running and jumping. These activities may generate increased pressure in your tummy, which may then place increased pressure on your bladder. Leaking may occur if the urethra, which is the tube through which we pass urine, is unable to remain closed against this increased pressure. With regards to urge incontinence, this refers to leaking associated with a desperate urge to get to the toilet. Patients commonly discuss needing to rush to the toilet and not making it to the toilet on time. Some patients may have particular triggers for this urgency and leaking. For example, that it is associated with approaching the front door or trying to undress next to the toilet, or even when hearing running water. Urge incontinence may commonly be associated with concern or worry about needing to go to the toilet and knowing where the closest toilet is. There are also other bladder symptoms that some women will report. Improving these symptoms may also form part of our goals of physiotherapy management. These may include experiencing a strong urge to go to the toilet and rushing to the toilet, going to the toilet all the time, which is called frequency, getting up frequently at night, bedwetting, and incomplete bladder emptying. Whether you have urinary incontinence or pelvic organ prolapse, or both, you may experience some of these other bladder symptoms. These may therefore form part of our physiotherapy management goals also. When we think about bladder symptoms, it sometimes is helpful to think about what's normal or ideal with your bladder. So let's have a look at this now. Ideally, we should be able to sit and relax to pass urine without pushing or straining. We should empty our bladder 6 to 8 times in 24 hours and be able to last around 2 to 4 hours between visits to the toilet. A good volume to pass when emptying your bladder is between 300 and 600 ml. These numbers are based on a recommended fluid intake of 1.5 to 2 litres per day. At night, a typical number of trips to the toilet can vary depending on your age. Before the age of around 50, we often don't need to go or may need to empty our bladder once at night. After this age, we may need to go to the toilet once or twice. One reason for this change is that there are hormonal changes that occur as we age. As mentioned, some women may report that they have difficulty emptying their bladder or feel that they're not fully emptying their bladder. It is important that we don't push or strain to empty the bladder. If you feel that this relates to you, let's try the following. Try sitting and relaxing to pass urine. Take your time, and at the end, you could try rocking your pelvis forwards and backwards a few times, and then stand up and sit down again, and wait a moment longer. Try not to push or strain when emptying your bladder. Let's now think about fluid intake. It is recommended that we drink between 1.5 and 2 litres per day. Some women will report that they restrict their fluid intake because of their bladder symptoms, but this can lead to dark, concentrated urine, and it can actually make your bladder symptoms worse. Not only is it important to drink enough fluid, what you are drinking may also affect your bladder symptoms. Some drinks may irritate the bladder, and these may include caffeinated drinks such as tea, coffee, green tea and hot chocolate, some fruit teas, particularly citrus juices, which can be acidic, carbonated or fizzy drinks, diet drinks, which may contain aspartame, and alcohol. So, if you experience urgency, frequency or urge incontinence, have a think about what you drink. We would encourage you to reduce or eliminate your caffeine intake, but please do this gradually rather than stopping immediately. Some women may choose to switch to decaffeinated drinks, although it is important to be aware that many decaf products still contain some caffeine, and the process of reducing caffeine may introduce additional products which can also be irritating to the bladder. You may wish to try substituting tea or coffee for fruit or herbal teas. As mentioned, do make these changes gradually and try these changes for around 4 weeks. Monitor any changes to your bladder symptoms to see if this has helped. Sometimes a bladder diary may help to track any changes with your bladder symptoms. This is something that your physiotherapist may ask you to complete to help better understand your symptoms. And again, ensure that you are drinking enough. Try to gradually increase your fluid intake if you tend to restrict your fluids. I'm only going to very briefly mention the pelvic floor muscles here, because you should have also received a link to our pelvic floor exercise video. This goes into more information about the pelvic floor muscles, what they do, and how to develop your pelvic floor exercise program. The pelvic floor has important roles, including helping to maintain continence, supporting the pelvic organs, and assisting in sexual response. Pelvic floor muscles can become weak for a number of reasons, including pregnancy, delivery, particularly vaginal and instrumental deliveries, and for women who have had more than 3 deliveries. Menopause. During the menopause, there is a reduction in estrogen production. This can affect your pelvic floor because estrogen promotes collagen growth, increasing plumping of the tissue, which in turn increases its support and strength. Constipation, lifting, and obesity can all lead to an increase of pressure on the pelvic floor. Smoking, as nicotine irritates the bladder and also causes muscle weakness. And chronic coughing can also cause repetitive stress on the pelvic floor. There is good evidence that strengthening your pelvic floor muscles can help improve symptoms of pelvic organ prolapse and urinary incontinence. And in many women experiencing these symptoms, pelvic floor strengthening exercises are recommended as the first line in the management of these conditions. We're now going to consider the bowels for a moment, as factors such as constipation and straining with your bowels can make bladder or prolapse symptoms worse. Normal bowel opening can be anywhere from 3 times a day to once every 3 days. The type of bowel motion is more important than the frequency. On the Bristol stool chart, type 4 stool, so soft but formed, is the ideal stool. Good fluid intake and a good, varied, fibrous diet may help keep stools soft and motions regular. Try to ensure that your diet includes solid fibre, such as fruit and vegetables, notably those with skin on, as well as insoluble fibre, such as grains, seeds, and brown bread. Try to open your bowels when you get the urge, rather than deferring, as this can cause more water to be absorbed from the stool and make it harder to pass. And lastly, avoid straining, as this can put pressure on the pelvic floor and worsen prolapse. The optimal position for bowel opening is to sit on the toilet with legs comfortably apart and with knees higher than your hips. Raising feet on a step may help to achieve this position. Then, lean forward with elbows resting on your knees and a straight back. Try to relax and avoid straining. Gently bulge your tummy out, keep breathing normally, and take your time. There are many other factors that can influence bladder and prolapse symptoms. To finish, let's consider some of our other top management tips. Maintaining a healthy weight range is important, as increased body weight may put increased pressure on your pelvic floor. Losing weight may improve symptoms of both prolapse and incontinence. Some of our usual daily activities may also put increased pressure on the pelvic floor and pelvic organs. This includes lifting. We can't always avoid lifting, but aim to reduce lifting and minimise heavy lifting, particularly if you have prolapse symptoms. Also, trying to engage the pelvic floor muscles with lifting may provide more support. We talk about this more in the pelvic floor exercise video. High impact exercise such as running and jumping can also increase the pressure on your pelvic organs and pelvic floor. Low impact activities such as walking, swimming and cycling may be more appropriate whilst you're building the pelvic floor strength. However, we will discuss and include your exercise goals as part of your physiotherapy management. In summary, in this video we have discussed pelvic floor conditions including stress urinary incontinence, urge urinary incontinence, and pelvic organ prolapse. We have also reviewed some bladder and bowel care advice to help manage these symptoms and other top tips. We would now encourage you to watch our pelvic floor exercise video. We hope that you found the advice discussed in this video useful. Our aim is that you can take some of the advice from this video and start to put it into practice, as well as to start to develop a pelvic floor exercise program. One of our team will be in contact with you to discuss a physiotherapy appointment where we can further discuss your symptoms and physiotherapy management. Our contact details are provided at the end of this video if you do have any questions.